Afternoon, everyone. It's Michelle Hill with Southern Inspirations. Happy Fruitful Friday, and thank you for joining the broadcast. As you may know, I posted earlier this week that I was focusing on being kind to our minds with my next several guests. And this afternoon, I'm happy to introduce my guest, Q Munford. Hey, Q, how are you doing?
Hey, Michelle, thanks for having me.
Oh, you are so welcome. I'm so excited to have this opportunity to have you on the show to talk about mental health, particularly as it relates to COVID-19 and the crisis we're in right now. And just Q, with your education and your background and your experience and your knowledge and your heart for people, excuse me, and compassion, I'm just honored that you've taken the time out of your frontline role, because you do have a frontline role, to be with us. So thank you again.
You're more than welcome, Michelle. So as you alluded to, I do have a frontline role in the current public health crisis. I'm an epidemiologist for the state health department. As an epidemiologist, we do a lot of the data analysis that you guys see in the press releases and as well as on the news and stuff. But besides being an epidemiologist, I am just truly passionate about population health and ensuring that people are aware of the things that are happening to them and things that are happening around them. With public health, we often tend to utilize words that are unique to our profession that sometimes the general population doesn't understand. So in addition to being a epidemiologist, I'm also certified in health education, which is a technical way of saying that I specialize in health literacy and really breaking down that data that we collect in a way that people can understand, but also in a way that people can relate to and understand, like, what does this really mean to me? At the end of the day, what does all of these recommendations mean for me and for my family? Because that's really what matters.
That's right. Um, you said something that resonated, and I know we're going to get into that a little bit more, and that's the terminology that we're all using. There's so much out there right now, and it can be confusing. I know that you mentioned just a little bit what your role is, but tell us, before we move forward into the specifics, tell us a little bit deeper about your background. I know that you just have a plethora of experience that has led you to this point of your role with the state now, but I want people just to kind of know, I mean, you're an expert. I mean, you really are. And so the things you're going to bring and share with us today is going to be so helpful.
Awesome. So I have a bachelor's degree in biology and chemistry with a minor in child psychology from the University of Alabama in Huntsville. I have a master's degree in community health, which is the underlying academic background for my certification in health education. I also have more than 10 years of experience in public health practice, including working in programs such as public health preparedness, lead-based paint prevention, ensuring that children who are exposed to lead-based paint or poisoned by lead-based paint get the assistance that they need. And I currently serve as the enteric disease epidemiologist for the state. So enteric disease is just a fancy way of saying that I look at all of the diseases that are associated with the food that we eat and the water that we drink. As a health educator, I've been certified as a health educator for about 7 years now. With that, we are very skilled in looking at the behavior theories. What really drives people to make change? What motivates people to change? What prevents people from making change? Those theories are very, very important in this climate that we're in right now, because as you see, directives are put out, instructions are put out by the governor, by the Secretary of Health, that not everyone will adhere to. We know that there will be people that will be delayed in uptaking those directives, but there'll also be people that just never adhere just because they're just not at a state of readiness to do that. And it really comes down to a matter of why. Do people find that they're at risk? Do you consider yourself to be at risk? Because if you don't consider yourself to be at risk, the chance of you making a behavior change, is very unlikely. So we have to be very clear about what the risk is, regardless of what type of disease we're talking about. We have to be very clear of what the risk factors are for individuals.
Absolutely. And so, with that said, I know that you, being on the front lines in your role, you are seeing lots of individuals, you are seeing lots of people that would be considered at risk. I guess let's talk about that a little bit to educate us on kind of what that means, and then take us into some of the other terminology too that's being thrown around right now. With, quarantine and isolation and shelter in place and all these things we hear. Would you help us like unravel and understand all that?
Oh, most definitely. Most definitely. Glad to do that. So when we talk about risk factors, some of the things that are identified as risk factors of people having a severe case of COVID-19 includes having chronic disease such as diabetes, and heart problems and things like that have been identified as additional risk factors. Also, being older. It's more difficult for someone who is older to recover just because their immune system, their health overall is not equivalent to that of most young people. So we have to be mindful that, a healthy person may get the virus and never show symptoms. But someone who is immunocompromised, who has a weakened immune system, or someone that's older, or a young child, they're more likely to have a more severe case of it. So just because you don't show symptoms or you bounce back, quickly, we have to be mindful. So this is definitely a situation that is about we and not me. We have to be mindful and respectful of our neighbor. That something that may not harm us could definitely kill someone else.
Right. That reminds me of the conversation that my husband and I have had about the mask.
Yeah.
And it's that we should wear the mask to protect others. It's not necessarily to protect us. And so if we all, do that, if we are in public, that's putting that care toward our neighbor. Because we don't know if we're walking around with it, whether we're asymptomatic or not. We don't know that if we're a carrier or not.
Exactly. And you're exactly right. You make a very valid point that the mask is not about protecting yourself. It's about making sure that, I tell people, the simplest way I can put it is to make sure that all the germs that belong to you stay in your face. We're in a season, where, we're in Arkansas and people are coughing and they're sneezing just because of the season and the pollen and everything that's going around. We may be dealing with seasonal allergies, but also be carrying the virus as well. And so by ensuring that all of our bodily fluids may maintain their space, we're making sure that we don't spread that to other people. And so it's definitely about being mindful of your neighbor and being respectful of your neighbor that may be vulnerable.
Yeah.
Couple of other terms that I like to talk about is quarantine. You mentioned quarantine and isolation. I love these words because people use them interchangeably and they're not one and the same. A person is quarantined when they've potentially been exposed, meaning that they may not be showing symptoms and they may not ever develop illness. They are being quarantined for the incubation period or the time that is expected that, hey, you were exposed, and that incubation period is 14 days. So within that 14-day period, that's when you're most likely to start to get sick. And so by not being out amongst other people, if you do develop symptoms or you're carrying it, that ensures that you don't spread it to other people. Okay. Isolation is a term reserved for someone who is ill. Isolation is to keep the sick away from the well. So if somebody is in isolation, then they are definitely confirmed positive, carrying the virus, and we want to make sure that they're not spreading it to other people. And so quarantine is for someone who has been exposed, but not necessarily positive. And then isolation is for an individual that is positive. So when we talk about that, we can talk a little bit about prevention measures in terms of the difference between a ventilator and a respirator. So a ventilator is...
I hadn't even thought about that one. And hold on just a second. I want to pop up. I was typing in because I want this to be where people can screenshot it. So I want to make sure I have it right. I was typing when you went into the ventilator, respirator. Quarantine is for someone who has been exposed but not necessarily tested positive, correct?
So they have not tested positive. They've been exposed. They are not a case. They have not.
Okay. And then give me your isolation definition because I want to get it typed in.
Isolation is an individual that is sick. So it's keeping the sick from the well.
Okay.
So a person is isolated when they
are sick.
Yes, that they are positive.
Okay. I'm going to say who has tested positive, who is sick or tested positive. Okay. I want to take a minute to get that in there because again, I want to be able to put that up there and people be aware.
Yes, exactly.
Keeping the sick from the well. I mean, that's an everyday common sense, right? That has nothing to do with COVID.
It has nothing to do with COVID. Exactly. Yeah. That is for anything that is highly infectious. You want to make sure that we keep the sick from the well. And I tell people the easiest way to think about it is that when you take your child to the pediatrician, there is a well side and there's a sick side. So the sick kids are being isolated from the well kids. You're trying to keep them separated from one another so that those kids that are well, that are just there for their annual checkup, their monthly checkup, their vaccines, they're not exposed to the coughing and the sneezing and the diarrhea and the things that are floating around on the sick side.
Makes sense. Well, thank you for letting me get all that in.
Oh, no problem.
So clue us in on ventilators versus respirators.
Okay, so the easiest way to think about ventilator and respirator. Ventilators are for patients. Respirators are for the healthcare provider. Respirators are PPE or personal protective equipment. It's what the provider is wearing to ensure that they're not exposing themselves to what their ill patient has. And so respirator is for protection for the provider. A ventilator helps ensure that the ill patient continues to breathe. The simplest way I can put it. So, we are not going around in the public with ventilators on because guess what?
I don't mean to get tickled, but trying to find some humor in it. I can only imagine you being in healthcare, what you hear and you see that just makes you go #SMH, like shaking my head.
Oh yeah,
very, very serious. So I'm not trying to be disrespectful at all, but I love how you just break it on down.
So yeah, that's definitely key. And as we speak, just a second. Give me just a second.
Sure. Everyone, thank you so much for being here. Q is so knowledgeable, and I'm so just thankful that she was willing to take some time out of her day. She is working, that is her office there with the state, and so please do excuse her having to step away for just a moment, but I have so much respect for her and all the others in the healthcare environment who are continuing to provide for us and put themselves at risk. So Q, I was just telling them that, you had to step away and because you're one of the people that are continuing to take care of all of us. So,
yeah. So I apologize about that, Michelle. I just had to take care of something really quick.
That is okay.
Never stops. We are constantly going. Public health. This is truly a public health issue, and we are, tackling it every single day. So yeah,
absolutely.
Some of the more difficult terms that we see people misuse most often, or confuse people. One thing that you did mention that I wanted to touch base on that has been a source of concern for a lot of people. Why isn't Arkansas on a stay-at-home order?
I'm so glad we're going to talk about this.
Yeah, so that's very interesting. That's been, a lot of debate of if we just, go on a stay-at-home order, shut everything down, then everything will be okay. But when you look at the transmission rates in Arkansas compared to our neighboring states, our transmission rates are substantially lower than other states because public health directives have been put in place in order to decrease transmission. businesses have been closed, salons are closed, gyms are closed. You can only get you can only dine out if you do, takeout. Schools are closed and students are using, alternative methods of instruction. There are a number of things that have been put in place that, hey, there is no need for a stay at home order. You see states that have these mandates where people have curfews and they can't go anywhere and everything's shut down, but their transmission rates are still higher than ours. So it's just putting a tighter chokehold than is necessary on the community, whereas there are already things in place that limit the number of people that are out and about. And people have been very proactive about, when they are out, practicing social distancing. Retail stores are being more proactive, limiting the number of people that are in stores. These are all public health measures, steps that are being taken that are not just, hey, we're going to do this because everybody else is doing this. But these are data-driven decisions that people are looking at the data and making decisions about what's going to happen to Arkansans based on data. So that is, that's a big topic of discussion, but I just want people to know that our transmission rates are definitely lower than what they were projected to be. And that's largely contributed to the public health measures that have been taken.
Thank you for explaining and clarifying that, because I know you're exactly right. That has been a question at the forefront of many folks' minds. I was reading something the other day, or maybe it was one of the governor's reports, that for the majority of the southern states, we have fewer diagnoses per thousand, individuals than most of our sister states. So I think we're doing something right. And I agree. I think, for the most part, people here are taking it serious. They are taking some measures. I mean, you have some people that probably aren't. That's probably going to be wherever you go. You just have some people who aren't the rule followers. But you can definitely tell that we are leading the way as far as that goes. Well, let's transition to talk a little bit about mental health. And I think it's a good segue, as we were just talking about having these measures to where people are staying at home. And I was sharing with you earlier, I've not been away from my house. I've been at home for 5 weeks, and that's just a choice that we made. My husband still has to get out and work, but he's being very, very, very cautious. But here we all are, and we've been catapulted into a completely different work environment. Many families with children at home to homeschool. Life as we knew it has completely been turned topsy-turvy, at least for the moment. And that regular life without a crisis has enough stressors to go with it, right?
Oh, yeah, for sure.
So, but during this time, it can really be heightened. And so I know you've put together 10 very specific steps, and I want to share those. It's just things that we can do to make sure we are maintaining our health during this time. But before I pop it up, could you just kind of speak to that?
Okay, so we, Dr. Tiana Jenkins, which is the owner of Plate It Healthy, she and I were talking about, what are people really, dealing with right now? And it became very clear to us that, dealing with this, the shift in schedule, all of the chaos and confusion, the overload of information is creating a mental strain for many people. And so we wanted to do some research to kind of figure out what are some recommendations that we can make, to women, but also to just everybody in general around this crisis, things that people should be mindful of. And so we were able to look at some of the other public health measures, other public health events. What have researchers found that after the fact, after we've gotten through the crisis, what do people struggle with the most? And so these 10 recommendations are evidence-based recommendations that are driven from research that we did on our own.
Thank you. Well, I am gonna pop it up here, and y'all give us just a second. For those of you watching, it's going to kind of cover us up for just a moment, but Q and I are going to move to the side so that you can still see us, but we want you to have a good view of the 10 things as well. So here we go.
Awesome.
Yeah.
Well,
So you run through those and kind of speak to those. It's a beautiful piece.
Awesome. So now that you have time to surrender your cape. So as women, we tend to get caught up in the busyness of the day. We run here, we run there. We're taking kids to practice, making sure kids do their homework, trying to cook dinner, all of these things that we're accustomed to doing. But we've had to surrender our cape because a lot of things are closed, and a lot of things that we're just used to doing in our routine have been taken away. But it's important that we remember that although the cape has been surrendered, the magic is still there. And so CAPE simply means that we want to stay committed to achieving personal and professional excellence. Committed to achieving personal and professional excellence. We want to view this as a time to grow both personally and professionally. And so, in order to do that, these recommendations kind of will aid with that. The first one being protect your space. It's very important that we utilize this time to protect our space, to make sure that we're keeping things organized, that we're utilizing this as an opportunity to get our space in order, but also that we're mindful that we respect our space enough to limit those that are coming in and out because of the rules and regulations that are put in place. But we also have to protect our space when it comes to being in close quarters with our loved ones. We want to ensure that everyone has an opportunity to get that alone time, to decrease conflict within the family. So protecting the space is a very complex, recommendation, because there are so many elements of that in terms of making sure that we create, if we're going to be at home, we want to make sure that we're maximizing that space and that we are being conscious that being in close quarters, we may have to be creative. For example, if kids are working at home and you're trying to do schoolwork and you're trying to do work, it may be that, hey, for 30 minutes, somebody's going to sit out on the patio, and that's going to be their space where they go out there and they have their alone time and they're not interrupted if you have nowhere else to go, because not everyone has lavish homes where they can separate into separate quarters, but we can all be creative in how we do that. Okay.
Absolutely.
Number 2 is maintain or establish healthy habits. The biggest thing that as we continue to navigate this thing is that I am snacking on everything, eating up everything.
Yeah.
It's important that we utilize this time to maintain or even establish healthy habits. Michelle, I love the fact that you offer, different recipes. This is an opportunity for us to explore. You know what? Food can be limited sometimes. That may mean that you have to get something different from the store. Use it as a positive. Hey, I wasn't able to get what I'm accustomed to, but I'm going to try a new recipe. I'm going to introduce a new vegetable to my family. I'm going to introduce a new spice to my family. Just use it as an opportunity to grow, to expand your palate. But not only just talking about the food we eat, we also want to establish or maintain our physical activity, making sure that we're finding time to take care of our physical health, whether it be taking a walk with the family. This may be a time to incorporate, hey, every night after dinner, the family goes for a walk. This is a habit that you can start now and just carry forward, because guess what? Everybody wants to get out the house now, so you can get them to do it while it's easy. And then, we have enough time to create a habit that it just becomes something that the family does.
Right.
The third thing is very important. It is understanding your risk. But in understanding your risk, I want people to be mindful of where they get information. Not all resources are good resources. Just make sure when you get information that it's from a reputable source and that it is not opinion based. I tell people that if you are reading a piece and you're trying to get some advice, and the sentence says they said, it's probably it's not a reputable source.
Because nobody really ever knows who they is, right?
Nobody ever knows who they is. Who is that? We don't know who they is. So, the state health department provides a lot of information. And if you can't find what you're looking for from the state health department, you can always go to CDC or the National Institute of Health or some other, government entity that will be able to provide you with information, or a reputable news source. Just make sure that wherever you're getting your information from, that is accurate and that is not a biased piece. Okay. Number four is connect with others. This is a great time from a business perspective to reach out to people. Those connections that you lost sight of, or you just can figure out, hey, I really vibe with this person and I like what they're doing, but I just didn't have time to really get to know them. Do a virtual coffee. Utilize it as an opportunity to get to know people, reach out to people, and find out how can you be a help to them. What can I do to help you, or what can you do to help me? You will be surprised at, if you just reach out to people, how much you can grow and flourish. And it just feels good to be able to connect with others when we're so disconnected from our norm. Discover self-care. Self-care is essential all time at all times, but this is an important time for us really to be mindful of self-care, especially when we're working from home. That self-care can just be making sure that you implement breaks so that you don't overstress yourself, that you're walking away from the computer. That's good for you mentally, but also good for you physically. If we're just sitting in the same place all the time, then we start to have aches and pains that we didn't have before. And so making sure that we're mindful that if we're working from home or in unusual situations, that we're getting up and moving, and that we're also giving ourselves an opportunity to just let our minds be free. Manage your time. Manage your time is, it kind of goes with maintaining healthy habits and protecting your space. You want to manage your time. So it's so easy when we are out of our normal routine to just get to the end of the day. It's 5 o'clock in the afternoon. I still got on my pajamas and I have accomplished absolutely nothing. And that is because I didn't set out at the beginning of the day with an intention to get X, Y, and Z done. So it's very important that we make sure that we structure our time. So although we may not be leaving the home, we should still, block out our time so that we know what we're doing and when we're doing it, so that we can hold ourselves accountable, so that we can continue to maintain and achieve personal and professional excellence. That means that we have to be intentional about how we're utilizing our time. We have to be intentional about how our children are utilizing their time, especially if they're at home doing AMI. You don't want your children sitting still for, big blocks of time, because they're not learning. They're not maximizing their learning potential when they're just sitting there cramming everything in. They're just going through the routine. And so you want to make sure that you are cognizant of what everyone in your home is doing, and how they're making sure that they get up and stretch, making sure that they take mental health breaks, making sure that the family's conversing about what's going on. Just really, just in the morning, this is what I like to do. In the morning, I set out and make an agenda of, I need to accomplish these things. And then I try to time block them on, okay, I'm going to give this much time to this and this much time to that. Am I always successful? I wish I could say that I was, but I'm not. But at least I have something to work with. And I know that I don't get to the end of the day and my whole day has been wasted. Because one wasted day will turn into a wasted week, and a wasted week will end up turning into a wasted month. And so we'll get out of this and realize that we're behind the curve in opposition to being ahead of it.
Yeah, good point. Very good point.
Explore your creative side. So a lot of times during all of this, we think about, I've got to do this, I've got to do this. Kids have to do all of their AMI work. We have to make sure that we're meeting all of our deadlines at work. But just for our mental sanity, it is important that we carve in time to be creative, whether that's singing, dancing, making TikTok videos, painting, drawing, writing, whatever it is that allows you to enter into that creative space where we're not just being overly analytical, where we're able to just be free and let whatever beauty is going to form to formulate, because that gives us a sense of peace, but it also gives us an opportunity to just kind of exit outside of busyness and just really just focus on creating something beautiful. It can also be gardening. This is a great time, to garden, to plant something. And as we continue to progress through this, watching it grow, just creating something beautiful.
Yeah, I've had some conversations recently just with some friends and some posts that I've seen on various social media about people embracing, some of those creative things. Mm-hmm. And Hughes, some people have discovered or rediscovered some talents and skills and abilities that they had, and like, oh my goodness, I haven't picked up the guitar in 20 years, or I just remembered why I loved painting so much, and so I think our brains need that. If you're constantly in analytical mode, like you mentioned, we're ignoring that whole other side of the brain.
Oh
And
yeah.
we need to embrace those moments of time so that then when we come back and we do have to sit in the chair at the desk for several hours, we can be even more productive, I think.
Exactly. It increases our productivity for sure.
Yeah.
Number two is own your no. It is very important that during this time, it's so easy, so easy to just want to say yes to everything because we're like, oh, well, I'm stuck in the house, can't go anywhere, everything's been taken away from me, so I'm just gonna say yes to everything. But it's important that you own your no and that you really are intentional about how you're utilizing your time and where you're investing your energy because we can still get burnt out even though we're not in our normal routine. And so I want people to really utilize this opportunity, this downtime for growth and development and being intentional about that growth and development. And that means that we have to be conscious about what lane we want to be in. I love to hear people say, I like to stay in my own lane. Yes, we do want to grow, but we can't grow in every lane.
That's right.
Yes, that's important. So again, I'm at it, so somebody else is coming in, but that's okay. Keep on moving on.
That's
Number
right.
is live lean. I think that is very important that we live lean during this time. When I say live lean, this is talking 100% about finances. We cannot go out and about. It's so easy. Okay, so I'm going to share a little bit about myself right now. I have a 1-year-old, and I'm obsessed with big bows, and I have to remind myself. I have to
Oh,
remind myself the baby only has one head. Like she does not need all of the bows. I have splurged a little
oh,
bit because it makes me feel good. And I like to see her in the little cute bows. Although she only keeps them on for a few seconds. But we have to be mindful that this is not the time for us to live elaborately. One, because resources are limited. One thing that is definitely limited in my neighborhood is toilet tissue.
oh
Guys,
yeah.
please don't go out and buy all the toilet tissue. Your neighbor
Mm-mm.
needs some too. And so
Right.
this has to do, living lean has to do just as much about you making sure that you are financially stable when we come out of this, but also about, not hoarding things so that your neighbor doesn't have any.
Right.
If you have 12 rolls of tissue at home, don't go buy 12 more because your neighbor has none. And so this is again, it's a situation that's about we and not me, that we have to be cognizant that our neighbor may be hurting, whereas we're just trying to stockpile. So live lean, buy what you need, and then, let's all be conscious of one another, but then also don't utilize this as an opportunity to just buy randomness. If you're going to
Right.
invest in something that's going to grow you professionally or personally, that's going to create something that when we get on the other side of this thing, it's going to put you a step forward. That's where we want to be investing our money right now, not in just buying frivolous things that, tomorrow will have no value.
Right.
And then the last thing I want to talk about is we're in a time of social distancing, which more so is about physical distancing, making sure that we decrease our physical closeness to people outside of our home. But that doesn't mean that we should stop being social. When we take away all of our connection to other people, that's a mental strain in itself. So I encourage people to filter social media, not to get off of social media because that may be some people's only connection to the outside world, but be mindful of your triggers. If you know that seeing all of this negativity is a trigger for you, it's going to make you sad, it's going to make you depressed, it's going to make you question everything, then filter those things out. Facebook has filters, Instagram has filters where you can filter out the things you're getting. If there are people that you follow that just keep you on edge, stop following them.
Yeah.
Stop following them. We have to be mindful of what we're feeding
Right.
ourselves, what we're feeding our minds, because what we feed our minds will eventually come back out of our mouths, and what we speak comes into existence. And so we have to be mindful of how we're feeding our mind. And so filtering social media is very, very important. So those are our 10 recommendations. What do you think?
Wow, they're all very good stuff. And they're practical. Nothing you talked about is anything that we can't do.
Exactly.
It's nothing very hard or difficult. It's just about having that mindset and being intentional. We have choices every single day. We get to choose our attitude toward whatever circumstances we're faced with in life. And so we can choose to thrive during this time and not simply survive. And I know there's all different stories and circumstances out there, and we're not all at the exact same place, but we can all do something with what we have.
Yes, we can all do something with what we have. It's all a matter of maintaining a healthy perspective.
That's right.
Look at it as the glass half full or the glass half empty. And I choose
right.
a half full mindset as we continue to navigate this.
Right. I do too. Well, in our last few minutes together, Q, would you share a little more with us about Mumford Associates and tell people what you do through that company in addition to your state role? And then I'll put the contact information up there so folks will know how to find out more.
Okay, so Mumford Associates is an innovative health education and promotion firm. And so we partner with physicians to provide in-house health education for their patients who are at risk of developing or recently diagnosed with a chronic disease, really helping people understand how their behaviors contribute to their health outcomes. We also partner with individuals and with groups and community organizations to help people understand, what their risks are, what chronic disease is, and things that they can do to modify their behaviors to improve their life overall. We also work with youth. We like to get youth engaged, particularly with them understanding the importance of what they put in their body, what that does for them. So we do a lot of gardening with kids to introduce them to new foods and things like that. So overall, we do health education and promotion at varying levels. We thrive when we partner with other people. And so we're always looking to connect with others to figure out how do we swing the pendulum on population health.
I love that. Another great service. I want to go ahead and put your email up here too. So folks want to ask you, dive a little bit deeper into learning. There's your email address. And then wanted to go ahead and pop up your phone number too.
Okay.
I thought I had that in earlier. You know what? Give it to me again. I'm going to type it in again.
Okay. It's 501
Okay.
954
Okay.
6282.
Say the last four again.
6282.
Put out for just a second. I had it in earlier. I'm not sure what I did with it. There's the phone number. So if people are watching, even if folks aren't watching right now and watch later, I wanted all that to be populated. Such a great service. You're so good at what you do, and you're so passionate about it. And there's so much to learn from you and your company. And I love the partnerships. And I'm just very, very grateful that I'm one of those partners to help you spread that word.
Yes, thank you so much for having us. We appreciate it.
You are absolutely welcome. And hey, final thing is you have, this is part two, but you have an event tomorrow that I think just falls right in line with many of the things that we're talking about. And it's called Break and Breathe Part 2. Bend, don't break. So tell me about that in case folks want to join tomorrow.
So my colleague, Bianca Johnson, and I do a small webinar every Saturday morning. So Bianca and I are students in the Doctoral of Public Health Leadership program at the University of Arkansas for Medical Sciences. And so we get a group of women on the phone to just talk about how we're navigating through, COVID-19 and the mental strains associated with it. So this Saturday, we're going to be talking about bend, don't break. You're in close quarters with your loved ones, your children, your toddler may be making an appearance while you're trying to do a conference call. Your husband is asking you where something is at. All of these things that we're having to deal with and adjust to in our normal of what's normal right now. And so we just have a real conversation. It is not formal. It is an opportunity for us to share, for us to vent, and for us just to know that we are not in this alone. So it's about building a community of safe space for us to share. about what we're going through. We will have a therapist online on Saturday to kind of give us some tips of how to navigate to maintain relationships. We want to make sure that we maintain our intimate relationships, but as well as our family relationships during this time, and that we don't create, things that have to be healed from while we're already going through a crisis.
Right.
So
Gosh.
join us on Saturday. We meet on Zoom at 10 o'clock. You can find the link on my Facebook page, mumfordassociates.com. We'd be glad to have you.
Sounds like that's going to be a fabulous event. And again, just creating that space to help everybody to understand it isn't just me. I'm not the only one, because it can so often feel like that.
Yes, it can feel like it's just you. It's not just your kids that you want to cope because they're not doing their AMI. It's not your husband that can't find everything. So it's we're all going through, and we're all, we can learn from one another. So what's working for me, I didn't think of, just hearing somebody else express what they're going through can be, medicine in itself. Just knowing that you're not in this alone. And so that's right. It's just sharing and creating a safe place for us to be open and vulnerable and transparent with one another.
I love it. Thank you for sharing that. This has been just a fabulous conversation. You've just brought so much to us this afternoon. Thank you so much. Is there anything else that you'd like to share with us before we close it out?
Wash your hands.
Oh, yeah.
And, listen to the directives, and it takes all of us. This is a we, not me situation, and we're all in this together, and this too shall pass.
You know what? I've got to type that in so that it's on here, because you've said that several times. Let's see. This is a we situation.
Yes. It's a we, not me situation. We got to.
This is a we. I won't change it. This is a we, not me situation.
Yes, for sure.
Okay, let me show that real quick. And I capitalize because we can often act like that. It needs to be we. It needs to be we with a W. I should have made the me the little m, but yeah. I think folks get the point. We are a team, and we are to think about others, and that's a golden rule anyway. So
yeah, I do want to extend this, Michelle. It's very important that people don't lose sight of their health. I do want to extend this. I do free consultations for individuals, particularly those that are diagnosed or at risk of chronic disease, especially, diabetes, hypertension, or if you're struggling with obesity. I want you to know that you do have a safe place to go. We can look at your wellness wheel and really identify what's holding you back, especially during this time, so that you can create some strategies. So they're welcome to check my website out and sign up for a free consultation. I'm glad to speak with anybody about their health and how, you can start moving forward and making good, healthy, health conscious decisions.
All right. I'm going to pop that up here too. Free health consultations. Check out your website, sign up, and we've put your number up there. Thank you for offering that too. That's a wonderful community service, and I feel sure that there's some people that can take advantage of that. Well, Q, again, thank you. This has been dynamic, informative, educational, and fun. You always
has been a blast, girl.
Appreciate you so much. Everyone that has watched, thank you. Thank you for tuning in and for supporting Q and for supporting Southern Inspirations. Please share this. There are many more folks out there that need this knowledge that she shared, and that may even need her service of health consultations. And so share, like, comment, do all of those things as we continue to partner together to bring awareness to the public on a very important subject. So with that, I'll tell everyone good afternoon, and we'll see you next time. Y'all have a wonderful weekend. Bye-bye.
Bye-bye.